evening. I'm Bill Bryant. Amber will join us live shortly. Doctors say RSV cases are on the rise in the Commonwealth. While RSV can affect everyone, it is the leading cause of infant hospitalizations in the U.S. WKYT's Mariah Congito has an update from both a Louisville hospital and a Lexington hospital as we head further into those winter months. Our top story at 5:30.
Last week, within all of Norton Healthcare, we had a record number of kids test positive for RSV.
Representatives with Norton Children in Louisville say what they're seeing this season is different than last year. They say the majority of RSV cases last year were in October and November, and so by this point, the cases started to trend down.
What's happening this year? We started to see cases begin to tick up in late August or early September, but we didn't really see a big spike in cases until this month, and cases are still going up.
Currently, Dr. Christina Bryant with Norton Children says they have 28 children hospitalized with RSV. 8 are in the intensive care unit.
The majority are under a year of age, and that's what we would expect. The youngest is about a month of age.
Doctors say this current spike is higher than any peak Norton Children's had during the 2022-2023 season. Dr. Bryant says they've recently opened an extra space in the emergency department to accommodate the influx.
We have the capacity to care for all of the children in our region who need care.
Here in Lexington, doctors at Baptist Health say they're seeing a typical intake of RSV patients for this time of year.
RSV can be very serious in both infants and older adults, and so it's not necessarily just the common cold. That's why if you're that 60-plus-year-old or you have some chronic medical conditions, to get the vaccine.
Symptoms can range. Doctors say the biggest warning sign is you or your child's breathing.
Last year, I think we were talking about the triple-demic of COVID, flu, and RSV, and that's something we assess daily.
Mariah Congito, WKYT.
And doctors say it is still too early to know if this year's RSV season will be worse than last year. Let's